For individuals over the age of 60, arthritis is rarely just a minor annoyance. It is often the single biggest barrier to maintaining an active lifestyle. While modern medicine offers non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, relying on them daily presents a significant dilemma for the aging body. As you age, your kidneys, liver, and stomach lining become more susceptible to the side effects of medications like ibuprofen or naproxen. Long-term use of these painkillers is linked to gastrointestinal ulcers, increased blood pressure, and kidney strain, risks that are statistically much higher in the senior population. This is where ginger, or Zingiber officinale, transitions from a simple kitchen spice to a potent therapeutic agent. It offers a pharmacological profile that rivals some prescription medications, but comes with a protective rather than destructive effect on the digestive system. To understand why ginger is effective for osteoarthritic pain, we must look at the biochemistry of inflammation. When you have arthritis, your body produces specific enzymes called COX-2 and 5-LOX. These enzymes trigger the production of inflammatory chemicals known as prostaglandins and leukotrienes, which are directly responsible for the swelling, heat, and pain signals in your joints. Most pharmaceutical painkillers work by forcibly blocking these enzymes. Research has identified that ginger contains bioactive compounds called gingerols and shogols. These compounds function as dual inhibitors, meaning they naturally modulate both the COX and LOX pathways. By dampening these inflammatory signals at the molecular level, ginger reduces the biological noise that causes pain, essentially turning down the volume on joint inflammation without completely shutting off the body's necessary maintenance processes. For patients over 60, the distinction between fresh and dried ginger is clinically relevant. Fresh ginger is rich in gingerols, which are excellent for digestion and general immunity. However, when ginger is dried or heated, gingerols undergo a chemical dehydration reaction and transform into shogols. Studies suggest that 6-shogol has a much more potent antioxidant and anti-inflammatory activity specifically for joint pain compared to fresh ginger. Therefore, for an arthritis patient looking for therapeutic relief, consuming dried ginger powder or heat-processed ginger extracts may provide a stronger analgesic effect than simply slicing raw root into water. This transformation is crucial because it allows older adults to consume a concentrated anti-inflammatory agent without needing to consume massive quantities of raw root, which might be palatable. One of the most compelling reasons to prioritize ginger in the senior diet is its gastroprotective property. This is a unique advantage over traditional medication. Almost all arthritis medications carry a warning for stomach bleeding or ulcers. In contrast, ginger has traditionally been used to treat stomach issues. For a person over 60 who might already be dealing with slower digestion or acid reflux, ginger acts as a prokinetic agent. This means it speeds up gastric emptying, moving food through the stomach more efficiently. By taking ginger to manage joint pain, you are inadvertently protecting your stomach lining and improving digestion, effectively solving two problems with one remedy. This dual benefit is rare in pharmacology and makes it an ideal, foundational supplement for geriatric care. Specifically regarding osteoarthritis of the knee and hip, the most common complaints in the over 60 demographic, clinical trials have shown promising results. A meta-analysis of randomized clinical trials found that patients taking standardized ginger extracts reported a statistically significant reduction in knee pain and disability compared to a placebo. Some studies specifically pitted ginger extract against diclofenac, a strong prescription NSAID. The results showed that while the drug acted faster, the ginger extract provided comparable pain relief over the long term, but with significantly fewer digestive complaints. For an older adult, comparable relief with a better safety profile is the gold standard of chronic disease management. It allows for the preservation of mobility without compromising organ health. However, ginger is not just for mechanical wear and tear. It also shows promise for autoimmune conditions like rheumatoid arthritis, which can flare up aggressively in later years. Rheumatoid arthritis involves the immune system attacking the joint tissue. Emerging research indicates that ginger can modulate the genetic expression of certain immune cells. It helps lower the levels of C-reactive protein, CRP, and other inflammatory cytokines circulating in the blood. While it is not a cure for autoimmune disease, Adding ginger to a treatment plan can lower the overall systemic inflammatory load. This is vital for patients over 60, as chronic inflammation is linked not just to joint pain, but also to cardiovascular disease and cognitive decline. Despite these benefits, the safety protocol for ginger in the over 60 demographic requires careful attention, specifically regarding drug interactions. Ginger has mild blood-thinning properties because it inhibits platelet aggregation. Essentially, it stops blood cells from clumping together too easily. For someone taking prescription blood thinners like warfarin, Coumadin, clopidogrel, or even a daily baby aspirin, adding high doses of ginger concentrates could theoretically increase the risk of bleeding. While culinary amounts found in food are generally safe, therapeutic doses used for pain management should be discussed with a cardiologist or general practitioner. Additionally, because ginger lowers blood sugar, seniors on medication for diabetes need to monitor their glucose levels to prevent hypoglycemia, as the combination of medication and ginger might work too well. For practical application, the dosage for arthritis relief usually falls between 1,000 milligrams to 2,000 milligrams of ginger powder daily, taken in divided doses. Taking it all at once can cause heartburn in some sensitive individuals. A highly effective method for those who cannot tolerate oral supplements is the use of a topical ginger poultice or ginger oil. The skin is semi-permeable, and applying ginger essential oil diluted in a carrier oil directly to a painful knee or knuckle allows the anti-inflammatory compounds to penetrate the local tissue without passing through the digestive system. This bypasses the liver and stomach entirely, making it an excellent option for seniors with complex medication regimens or sensitive stomachs. Another effective way to integrate this into a daily routine is through golden milk, or a ginger turmeric tea. Combining ginger with turmeric and black pepper creates a synergistic effect. Turmeric shares similar anti-inflammatory pathways, and black pepper increases the bioavailability of these compounds by up to 2,000%. For a patient over 60, a warm cup of this mixture in the evening serves multiple purposes. It reduces evening stiffness, aids digestion after dinner, and provides a soothing ritual that can help with sleep. Consistency is key here. Ginger is not a morphine pill that kills pain instantly. It works by building up in the system and lowering the baseline of inflammation over weeks. Patients typically report a noticeable difference in joint flexibility and pain reduction after 4 to 6 weeks of consistent daily use. Ultimately, for the aging population fighting arthritis, ginger represents a shift from symptom suppression to systemic support. It acknowledges that the body is an interconnected system where joint health, gut health, and heart health are linked. By using ginger, you are not just numbing a painful knee, you are reducing the oxidative stress that accelerates aging across the entire body. It empowers patients over 60 to take control of their mobility with a tool that is safe, accessible, and scientifically validated. While it does not replace the need for medical supervision, it is arguably the most potent natural adjunct therapy available for preserving the quality of life in the face of arthritis.